Alright, so I'm going to be repeating a few of the affirmative claims. The first one, the affirmative stated was that businesses are closing because they have to provide their own workers with health insurance. And I think, and we should all know that it will be even worse if we switch to universal healthcare, because a lot of businesses in the medical field will have to close, since a lot of the jobs will be transferred over to government agencies that will have to be created. Joe Messerly from Balance Politics states that the switch to free healthcare means many people working within the insurance industry will lose their jobs, and businesses that rely on that industry will also be closing. Another point I'm going to be refuting is that the affirmative stated that a lot of people are being refused health insurance because they have pre-existing conditions, and under pretty much Obamacare, this is pretty much short. Under Obamacare, people cannot be refused health insurance, or health companies cannot revoke people with pre-existing conditions anymore. So those are two of the points I wanted to make there. The affirmative case will not work in America. The current system does its job, and although it is in need of some reform, we do not need a government-run system. According to Weeconomics, which is an economic website, many doctors support reform of the current system, not what the affirmative suggests. The American Medical Association, the largest of its kind, also more broadly supports reform of the current system rather than government-run healthcare. Reasons why we should keep healthcare the way we have it. And I mentioned it previously, competition fosters greater innovation and entrepreneurship. The U.S. has the most sophisticated and updated medical services in the world. According to Greg Bulgarian from the Staffing Talks, 84% of Nobel Prize winners for medicine have gone to Americans in the last 43 years. This advancement given to the rest of the world is here because of the system we have today here in America. There is no question that having a privately run healthcare system in the U.S. has led to major advances in healthcare and medicine. The second point is that freedom to choose a healthcare plan that fits your needs. Anyone today can pick whatever healthcare choice or plan they want. You're not given a specific plan from the government, which will be provided, which the affirmative would have. You choose what you need, what you want. And we have tremendous choice in our system, and that's very good for patients and prices. Customer service is the next point. Market forces drive competition for businesses, resulting in increased convenience and customer service. Healthcare consumerism has driven patient-centered innovations that all improve quality of life. Examples include convenient walk-in clinics, online scheduling, services available in one-stop locations, and seamless transfer of health information. Also, the affirmative states that cost of emergency room for those without health insurance is a major problem. Well, according to Michael Tanner from LA Times, some suggest that when people without health insurance receive treatment in the ER room, the cost of the care is passed on to the rest of us. This is true, but it is a manageable problem. According to Jack Hadley and John Houlihan of the Urban Institute, uncompensated care for the uninsured amounts to less than 3% of total health care spending. It is a real cost, but no doubt it's not a crisis.